Welcome my viewer to my YouTube channel, The Wounded Healer, your encouragement channel. It has been a while since we had a topical session with you, and you're most welcome back again. It has been a while we have been watching the news, we have been listening to the politicians, we have been viewing different types of videos and tapes. But now I want us to get back to the business once more as we continue to learn, as we continue to get to know more about things that affect us as human beings, or things that affect each one of us at one time or the other. And by the end of it all, you'll be able to encourage someone, you'll be able to be encouraged. And that's why I'm telling you that this is a channel that by the end of it all, you will have to either encourage somebody or you will be encouraged. Today, I want us to talk about anxiety. And those who are listening to me for the first time, I am Jean Agnes Mathenge. I am a teacher, I am a pastor, I am a counselor, and I am a mother, of course married to one man, and a mother of 4, and a grandmother of 3. And I'm delighted to be with you in this YouTube channel as we continue to interact, as we continue to engage. And I would kindly request you that you like, of course you watch, you like, you subscribe, and if possible you can leave a comment, and you are most welcome. I want to tackle this topic of anxiety, and I'm sure we know what anxiety is. And even if we don't know exactly what anxiety is, we have heard about people talking about being anxious, people feeling that they are going through a lot of anxiety in life. And of course, it is caused by so many things that we are going to see. And it can also lead to so many other things. Anxiety, as many people call it and talk about it, it is something that people are not very sure whether it is a disease, whether it is an illness, or what is it. In fact, people call it something. And they say they are going through something like anxiety. But the truth of the matter is that anxiety is a disorder. And it cannot really be called a disease. It is not an illness, but it can lead to a disease or an illness. And it can also be caused by an illness or a disease. But anxiety is a disorder, and it is related to so many things that people talk about. Anxiety is related to panic. Anxiety is related to fear. Anxiety is related to attack. Anxiety is related to so many things that really contradict or confuse people when they are going through anxiety disorder. I'm just going to mention some of the common symptoms and signs of disorder that we go through. And most of us, me being a victim, I've been a victim of circumstance, and that's why I have told you that you'll be encouraged. Because some things, when people go through them, it's like they cannot understand life again. They curse themselves, and they feel as if they don't belong, and it really weighs them down. And sometimes anxiety can really make someone's esteem go very down because they don't understand what is happening in their lives. Some of the common symptoms and signs of anxiety is trembling or shaking. Someone who is anxious, you might find them trembling or shaking. And you can also find somebody sweating a lot, breathing very hard, or having difficulties of breathing. Somebody with the symptoms and signs of anxiety, they feel weak and tired The body is weak and tired. They don't feel like doing anything. They are weak and they feel that as if they have worked very hard. That is a sign or a symptom of anxiety. This person also feel less stress. They feel less stress. They are not settled. They feel tensed. There's a lot of tension in their body. They also feel nervous. It's like somebody who is expecting something or who is going through a fear of unknown. Another symptom or sign is struggling in thinking or lack of concentration. You are supposed to concentrate on something and you are not settled. You are not able to concentrate. You are struggling to think about something. And still another symptom of anxiety is whereby there is sense of impending danger. That is kind of panic. It's like you are waiting for something bad to happen. That is the anxiety. Ni kama vile unaweza pata mtu kwa barabara na ni usiku umstue. So that person will be anxious, or they will be going through anxiety because they are sensing an impending danger that will befall them. That is a sign of anxiety. And also anxiety, another sign is the increase of heart rate, whereby you find somebody roho inapiga sana. That is another a sign or symptom of anxiety. We say that anxiety can be caused by so many things. And one, anxiety can be caused by a medical or treatment cause. Medical or treatment is whereby someone can be ill or sick and they are going through treatment, but there is some anxiety in it. They are not sure what will become of the end result. Or they are sure of what will become the end result and they are doubting the treatment. Or they are not comfortable with the treatment. And that's how anxiety comes in. So it can be caused by medication or the treatment when someone is ill. Anxiety can also be caused by drug withdrawal or misuse. We talk about drug withdrawal whereby it is medically prescribed that you take such kind of a drug and then you withdraw all of a sudden. That one will cause anxiety because it is in your nerves and in the system. And withdrawal of any drug or any fluid in the body, it will bring anxiety. Also, withdrawal of alcohol, withdrawal of any abuse, it can bring anxiety. At the same time, when a drug is misused, or when there is misuse of drug or medication, it can also lead to anxiety. And we also say that another cause of anxiety, it is those people who suffer from asthma. When one is suffering from asthma or thyroid problem, they go through a disorder of anxiety. Those are medical causes. And we also have got chronic pain. When one is going through a chronic pain, chronic is a prolonged pain, a pain that is persistent. It is pain now, pain in the evening, pain tomorrow. That consistent pain, that chronic pain, it can cause anxiety. And also rare tumors. There are tumors that are very rare. Maybe a tumor that has not been diagnosed with many people, and you hear that you have been diagnosed by such kind of a tumor, you will become anxious. That is now in the medical a part of the causes of trauma. I mean not trauma, of anxiety. Another cause of anxiety is trauma, whereby you get a child or even a grown-up, an adult, going through uh, I mean traumatic events, or their past event, and they are the ones that we call post-traumatic stress disorder, PTSD. Post-traumatic stress disorder are events that happened, but they traumatized um, um, one's psychological part of the being in a way that they affect the current life. They are the ones that we call post-traumatic stress disorder. Those traumas, and most of them affect children. When the children are exposed to fights, when children are exposed to grudges, when children are exposed to what do we call them? Domestic violence. When children are exposed to abuse of any kind, it sticks in their minds and it traumatizes them. And later in life, if it is not dealt with, it becomes trauma, because it is sticked in their mind, it was not dealt with, and they keep growing with it. It affects the brain and it keeps on going. That's what we are calling trauma. And trauma can be of many types, or there are many types of trauma, varying from one person to another or from one age group to another, and also varying from cause, because their traumas are caused by different um, um, different things or different causes. Another cause of anxiety is stress. Stress can be caused by an illness. An illness can cause stress in most of the people, whereby you feel that you have been unwell, and before you recover, that period of sickness causes stress, and stress causes anxiety. We are saying that through the time of medication and treatment, someone can suffer anxiety. And most of the people, I have been, like I said, I will be giving my own experience. I've been working in a facility, health facility, for the last 5.5 years. And the kind of people that I used to meet every day, or that have been meeting every day, are people who are sick. People who are physically and psychologically sick. And when you meet with someone who is sick, whether it is physical or whether it is mental illness, they go through a stressful moment of their lives. And that's why even when I was doing my pastoral care sessions, and even when I was doing my counseling, I used to deal with the issues, or I used to deal with the primary issues of the patient, whereby we call it psychosocial, in order for you to get to know where the stressors, where the anxiety of the patient is coming from. Because you cannot go find a patient, diagnose them with anxiety. I will be told that they are anxious without getting to know where they are coming from, where that sickness is coming from, where this patient is coming from. And therefore, I would say that 99% of the patients that I have seen in the hospital, they suffer from anxiety disorder. And I think it is the one that is very paramount. Another cause of anxiety is stress buildup. Stress buildup is whereby something happens all of a sudden that one was not expecting. Of course, there is nothing that one expects. You don't expect to be sick. You don't expect many things that are negative to happen. But there are those things that we can call, like now, the loss of a beloved one, When one loses a relative or a person who is very close to them, they go through a process of anxiety. And anxiety comes with loss and grief. During that period of mourning or loss and grief, there is a lot of anxiety. Even before the person dies and they are very critical and they are very sick, there is a lot of anxiety with the relatives. Loss of a person, also loss of an item or loss of property, loss of finances, loss of loss of property. Maybe you have a car or you had a car and it was stolen. Maybe you had bought a rad and you just realized or you just noted that you are conned. Maybe you had some money in the bank and during the process you were stolen. Maybe it was even from the bank. Whatever causes that money to get lost, that is loss. Any loss causes a lot of anxiety, and that one can really make someone anxious, and it can also cause an illness, and most of them causes high blood pressure. It causes diabetes. It causes panic attack. So those stressors that are brought about by anxiety, and especially of loss, they are very dangerous. There's no anxiety that is good, of course, but there is anxiety that is too much than other anxieties, and it can really be very harmful or very dangerous to someone. Another cause of anxiety, it's the one that we call, or the one that can be caused by personality. Personality sometimes come with personality types. There are many kinds of personality types. There are those people who are called introverts. There are those people who are very outspoken, very outgoing. There are others that are very hot-tempered. There are others that are very calm. All these types of personality types can make someone anxious depending with the environment that they are living in or the people that they are living with. Another cause of anxiety is mental illness. Mental illness, as we all know, it's an illness that really traumatize people. Anywhere that you mention about mental illness, apart from the hospital, of course, we are used to seeing mental patients, and most in health facilities. Outside the health facility, when you mention about mental illness, people shy off. They don't want even to be identified with it. Even when they know they are suffering from it, they cannot mention, or they would not want to talk anything about a mental illness. And this one is the one that causes anxiety, because it's like you do not want anybody to know that you are going through a mental disorder or mental illness, and therefore this one brings anxiety, and this anxiety may bring your esteem very down, and you are not able to cope with your situation. Like myself, I would give myself as an example, because I'm not shying off. I have suffered from mental illness, and it gave me a lot of anxiety. I didn't know what to tell people when they ask me what I'm going through. And I was also always suspicious that people are talking about me. And I felt very, very, very much insecure. And that is anxiety. And it can also be very harmful. Something else is about blood relations, whereby we find that relatives, people live this genetically. You find that my mother suffered from anxiety, my grandmother suffered from anxiety. In the family lineage, there is somebody with anxiety. So all this brings about